morning, everyone. Welcome to the Data-Driven Government session on day 3 of the Festival of Innovation. I'm Xuan, GovInsider's Deputy Editor. Southeast Asia is undergoing a data and AI awakening, and in this panel, we'll take a look at how governments are working data and AI into their services, whether that's across healthcare, social services, or elsewhere in government. We're thrilled to be working with our partners at Cloudera for this session. Please join me in welcoming our brilliant panel today. First up, we have Dr. Leong, who is the Senior Principal Specialist of Platform Services, Data Analytics and AI and DNA at the Integrated Health Information Systems, or IHiS. Next up, we have Bruce Liew, who is the Director of Sector Digitalisation and Transformation Office at the National Council of Social Service in Singapore. And last but not least, we have Robert Carey, who is the President of Cloudera Government Solutions Incorporated and Vice President of Cloudera Public Sector. Welcome, gentlemen. Thank you for joining me this morning.
Thanks for having us.
Thank you, Poon.
Now, we can't really start talking about AI or better citizen services without first talking about data. So let's start our conversation there. And for Leong, let's start with IHiS as Singapore's National Health Tech Agency. How has IHiS used data to create better and more targeted services?
Definitely. So as you mentioned, we are the health tech agency for Singapore. So we supported the public healthcare institutions as well as the Ministry of Health. In fact, data is very important in the healthcare in the sense that everybody generates a lot of different data, especially in the healthcare. We have clinical data, behavioral data, such and such itself. So, and another thing I want to point out is that actually human bodies is also very unique. There's no two bodies that is totally the same. In that space itself, right, what data can provide is the in-depth view of a more targeted, so-called personalized treatment for people. So it's no longer a one-size-fits-all type of healthcare that we are looking at. So globally, the whole world itself is changing more to a personalized and also a more specific type of customized healthcare. But even having said that, right, we probably cannot do the full customization as everybody have a so-called different treatment. We still need some sort of a segmentation. So I just want to give you an example. If we are talking about a diabetics cohort, which is quite a case of in Singapore, the diabetics rate is a little bit quite high. So among the diabetics cohort, who are the patients who is likely to develop into a more serious disease like kidney failure itself? So all this information data can help us to find the patient of a similar characteristic or similar profile itself, and then give them an early warning or early intervention or even an early education that they must watch their lifestyle before things turn bad for them. That is probably the insights which the data can come up very useful for the healthcare itself.
Fantastic. And I think for diabetics in particular, I think that's a condition that lifestyle changes, personalized, choices, that's something that can really help to hold back on the progress of the condition. So I suppose in that sense, having more information is definitely something that will be a lot of use.
Very good.
Yeah. Okay, and I'm going to turn to Bruce next. So in this whole space of mental health, definitely it's been a huge topic over the past 1.5 years as we were all grappling with the pandemic. So I can only imagine that at NCSS, you've had to deal with a much higher demand, also while in the midst of shifting everything online, making sure that services can go on as per usual. So how has that journey been for you, and how has data been helpful?
Okay, thanks, Yuchen. Yes, actually, you point out two things. One is two things happened last year, right? One, of course, pandemic itself, right? COVID, and that has drove a lot of services online. It has driven a lot of SSAs or social service agencies to adopt technology. And you can imagine that with the adoption of technology, so has the adoption of analytics or data. But I must say, one is probably lagging behind the other. So while the increase of technology has enabled a lot more data to be collected, I suppose even at this point, it's a lot more data than a lot of SSAs might know what to do with. So even from just taking an internal perspective of just collecting all this data and using them to plan for better services, to maybe plan for upstream, more predictive kind of intervention. And you mentioned mental health, right? Are there ways to even detect, the stresses and all that before certain clients seek help or call the crisis hotline, for that matter, or even when on the brink of suicide. So some of these things, while the intention and will is definitely there, I suppose there is still a lack of know-how on how best to utilize all this data that's been collected. Then externally, the other thing that SSA is cognizant of is really collaboration and the sharing of data. So you can imagine if an SSA collect information about one client, and that client probably may or may not be the only, or should I say, the agency may or may not be the only agency that the client visits, right?
Yeah.
And how do we then consolidate to have a more holistic view of the client? If the client is seeking help for different things from different agencies, then how do we piece all this together? So, so two parts. One, of course, is a platform already available? Is there a common standards available for data sharing? And just as importantly, are there policies in place that allow some of these, as opposed to fear of the unknown? What can be shared? Are we contravening PDPA requirements and all that? So these things have been happening in the past year or so, and these are some of the things we try to chip away slowly but surely.
Absolutely. And I think just now in our conversation before we came on live, we were talking about how health is a lot of times not just purely a health issue. It may not always it may not even be an IT issue, but sometimes it's a social issue. So there's a lot of those overlaps in the different areas that different agencies are looking at. So Rob, I'm going to turn to you for this one. I think data sharing is going to be a huge part and definitely a prerequisite when it comes to improving our digital services. So how can governments make data sharing easier?
That's a great question. And there are some very basic answers to it. I think the panel would agree that we have an overabundance of data. And the question is, who has access to it? Who owns it, right? Who's in charge of taking care of it? The old days, we would call it authoritative data. This is the data that you want to reference, right? So getting governments and agencies, departments to share really becomes a culture issue, right? It really becomes how do I build trust? How do I collaborate with adjoining agencies who need this data to perform their citizen services, but the loss of control of the data seems to be a challenge at times. So in a way, adopting open standards helps that. Avoiding vendor lock-in helps the transportability of the data. There are some folks in this country that Xuan will think you should build data to share to start, not to hold it and protect it, right? So you sort of flip the paradigm, and that's helpful. But the piece that's lacking, and that really does help with sharing, is providing powerful identity control or role-based access to the data. So if you've guarded the data properly and you've secured it, then you can direct who has access and who doesn't, who has read access, write access, what have you. And so suddenly, whether it's in financial management, energy, healthcare data, cybersecurity data, logistics, you name it, if more than one agency needs it, and I've given you the authorization to see it, you should be okay with producing results for your agency with that data.
Definitely. I'm going to turn to personalized services for a little bit now. So, Liew, I know there's this trend in healthcare that I think you've mentioned before as well, digital phenotyping. So this whole idea of collecting data from smartphones, tablets, all sorts of devices, of course with permission, linking back to what Rob said about security. But the whole idea of this is to pick out early signs of medical conditions. So this sounds like it's going to be a whole new level of personalized services. So can you explain a bit more about that and what the potential impact of digital phenotyping could be?
Actually, it's a very exciting field, digital phenotyping. So in short, digital phenotyping is that with digital devices, for example, like a smartphone, information can be so-called collected to infer whether the person has conditions or what is the next step in terms of healthcare that he should take care of. So it can be a user input type, or it can be a very passive, like the way that you tap your phone, that can be also a sign that maybe you have an early possibility of getting Alzheimer's itself. So all these is a very new field. As long as we get to know more about the patient, better treatment or earlier treatment can be given. That is a good thing itself. But of course, that with all this information, like what Bruce had mentioned just now earlier, we must know how to make use of the information, and possibly we need to open the door slowly as well, and not too fast itself. Like beside what you mentioned about data privacy itself or security, there are also things like are we introducing too much digital noise itself? We must know that the information we collected, how we should process it, what is the so-called baseline we are looking for before we take in all this information and try to come up with actionable plan itself. So that's one part. And the other part is, of course, the false alarm. Okay, if we have a lot of false alarm on that, this great idea may be very daunting, or people will just get digital fatigue. Every time I try to use a digital phenotyping apps or whatever, that is tell me that I may have certain condition and I'm very panicky, go and find a doctor. The doctor will be tired, I may be tired, but the whole thing will not be well. But having said that, this space is still a lot, very much so-called we should pay attention to, especially in the last year itself. The pandemic have really accelerated the digitization of the whole population. A lot of people now are very, very used to use a handphone or smartphone to get information from the apps, and also to contribute information as well. That is a good space that we should pay attention on.
Definitely. I think as more people step into the digital spaces, there are so many things and so many places that we can get data from. And I think it's really exciting to see, how all this data can potentially be used, not just in the physical healthcare space, but also potentially in the mental health space. So Bruce, I know earlier you talked a bit about, there are actually ways to maybe detect stressors early so that we can step in and maybe intervene before situations take a turn for the worse. So can you talk a bit about how the idea of personalized services can work or can be brought into the social services space?
Okay. If we're talking specifically about mental health, I suppose there's still a little bit of the stigma, in terms of whether people feel comfortable it getting a bit too personalized. So imagine if you're familiar with the SOS crisis line, it is still anonymous. It's completely anonymous. And that's possibly why it's so successful in the sense that there are people who call it and they can really get the help that they need. So I imagine if it's going to be anonymous, then the idea or notion of personalization, then it becomes a little bit, in a sense, it's a bit hard to implement. So there's a balance, specifically in areas where there's still a bit of stigma and all that, between how much you want to know or about a client or a person, and being able to personalize certain services and not like an anonymity. So there's a fine balance. And the other dichotomy really, it's the cross between high tech and high touch. So there is also this perception that once you get very high tech, it loses the high touch. And when it comes to social help, a lot of people still prefer the high touch. Yeah. So I share an example that happened last year. I shared this before, so you might have heard this, right? Really, it's during circuit breaker, clients who are undergoing counseling, like family counseling and all that, right, cannot visit social service agencies in person. So some agencies are quite quick to pivot that to Zoom telecounseling and all that. And that quite immediately pushed away a certain segment. Like for example, the seniors who are not so comfortable with talking to somebody online, stop going to the centers or actually tapping on the service for counseling. Whereas the younger, but they drew a different crowd, which is the younger population, which are quite comfortable, right, interacting with this, doing Zoom sessions, all that. So you can see this shift. And I suppose the other way of looking at personalization is then to have different services for different segments of the clients. Yeah, and then you got to know, what resonates with them, what they're comfortable with, and then move along those lines. And quite often, digitalization may or may not be the solution to it.
Right. And when you talk about different services for different segments, what could that possibly look like?
Let's say, just using one example of mental health, right? Crisis intervention, counseling, all that is a type of service. But it could come in different forms. For example, traditionally, again, I quote SOS, which is probably an example that most people are familiar with. They have this hotline, that's 24/7. It's anonymous. You can call anytime. They have done that, if I'm not wrong, for more than 30 years and all that. So it's quite successful. But they rolled out this thing called the care text, which is a kind of chat-based, text-based kind of help. And quite immediately, they have expanded their scope of service. So you can imagine by extending a different channel to target a different segment, that immediately avails help to probably a segment that is very much in need of such support, but have been undertapped. I mean, using a commercial term, right? Undertapped for the longest time, and just having a different channel, slight variation of service, does help open up this opportunity for them.
Absolutely. And I'm going to turn to Rob now. So, Rob, you come in from obviously that IT tech expertise sort of angle. So, when we think about personalized services, it seems like there are quite a number of things to think about, how to make sense of the data that we have, and also how to maybe segment it, like what Leong has mentioned earlier. So, what are some of the simple steps that governments can take to make personalized services possible, or indeed bring it to a higher level?
Well, so I guess the simple thing is to understand where your data is, right? And I think Bruce was talking about there's very different modes of delivering care depending on what care you're rendering and what mode the patient or the person might engender. And so it makes a difference because they create different data, right? So knowing where your data is, knowing your applications, in our world, we went back through one of my past lives, this application rationalization effort. So we had to go back in and start to kill applications that were old and producing legacy formatted data. This becomes very complicated very quickly because the data isn't all germane to where you're going. It's germane to where you were with that process. So governments have to really understand what are they trying to do? What's the mission, whether it's healthcare or it's whatever it happens to be, transportation planning, things like that, law enforcement. And then really it is a up close and personal examination of what's producing the data and can I analyze it? Can I manage the life cycle of the data, right? I have to ingest it. I'm going to organize it, collect it, enrich it. Then I can make some reports. Then I have a database or a data lake. And then there's a point in time where I'm going to run some analytics on it. So then I can derive answers with that enriched data that I didn't know that I was going to be able to get. And at that point, you're now in the advanced data user category. You're now actually rendering informed decisions with enriched data to help your constituents. So those are some of the things I think governments just really have to get their head around first before they dive in, because you can get overwhelmed pretty quickly in the data space.
Absolutely. I'm going to turn our conversation in the direction of AI right now. So AI is, definitely the shining star that is coming up in government services, lots of potential, lots of things that we're already beginning to see. So when we think about social services, then, so I'm going to come to Bruce first for this section. What potential does AI have when we think about social services?
Wow, it has certainly a lot of potential, right? So as with a lot of other sectors, the issue of manpower and resources is also an issue for the social service sector. So, just in terms of social workers, counselors and all that, there's probably not enough to go around as usual. and AI could possibly augment some of their work. So again, since you started using mental health as an example, continue to use the example, right? People calling helplines and all that. And you can imagine with COVID, that demand has greatly increased. People who are either suffering from mental health conditions or they're more aware, so they start to seek help through hotlines and all that. But the number of professionals and even volunteers who are handling these calls are finite, right? They remain largely the same. How then can AI help to augment some of their work? For example, like triaging, maybe even do a risk assessment. Is it someone who just needs a listening ear versus someone who is on the brink of suicide? So then you can route that to the right person. It could be a junior volunteer who can lend a listening ear versus a very seasoned, experienced, trained professional who's better equipped to deal with somebody who's on the verge of suicide already. So if things like sentiment detection and risk assessment, all this, if they can come in, that would greatly help some of these services that are already in high demand.
100%. And Leong, I think you are in a pretty unique position because you helped to create the first predictive healthcare model in Singapore that helped to predict patient readmission. So what were some of the lessons that you took away from that journey? What was that whole process like?
Actually, a clarification. So that predictive model is actually so-called the first for nationwide. So actually, readmission model have been used in the local hospital as well as the international for quite a long time, even as early as year 2000 itself. So actually, AI in healthcare is not new in the sense that you have gone through quite a decades of a new long journey itself. And the thing is that the good thing is that we are getting more and more so-called know what is this AI about. More importantly is the actionable and the potential it can bring to healthcare, especially in probably two aspects itself, which are in the healthcare, my colleagues and myself, or even our healthcare partners is always concerned about. It's about productivity or getting more insights from the patient. That will be the two good use of AI. And especially during this period of time, the last year pandemic, we see that AI use have been a lot widened, a lot from hospital operation to the triaging of patient, diagnosis, or even pre-screening. These have been quite a good use of AI. And if you ask me how we can actually make it so-called even better or flourish better, I would think that exactly what Rob had mentioned about is about the data itself. How can we make good quality of data for the AI? Because you always heard of this in IT, garbage in, garbage out. And in the AI itself now is that moving from the algorithm building, we are moving to the data-driven type of enhancement, which there's many saying now about this machine learning operation or even data operation. How we make sure all this data lineage or this pre-processing is well recorded and consistent. Most important, it must be consistent. We don't want the AI today to be performing like a star, very accurate, very useful, but the next day, because the data coming in, there's some differences or either through the system or actually even from the demographic change of the patient, then the AI become no longer useful. And if its performance deteriorate, at least you must be aware of it. And then you will have a good action how to rectify it. So that is the whole space of machine learning operation or even the operation of the data that's coming into place for AI. And that's how we can create the environment to actually ensure the AI is sustainable and going to flourish even better.
Definitely. And before we go into, I think, this idea of garbage in, garbage out, I think that's definitely something to talk about. But I wanted to stay on IHiS and healthcare for just a little bit longer. So just now you mentioned, I think, two baskets of AI applications in healthcare. So there's the productivity basket. There's also the part where understand a bit more from the patient's perspective, so getting insights from maybe their behavior, maybe their feedback, maybe their conditions. So can you talk a bit more about maybe some of the things that IHiS has done in both of these areas?
Sure. Definitely, in terms of so-called productivity itself, we are using as a decision support. As you mentioned just now earlier, some of these so-called predictive model that we have come out with together with our healthcare partners to know the prognosis of the patient. That means whether they are going to have a deteriorating health in the near future, and then apply early intervention. So that is like SIF itself. So from the mass of all the patients, we try to narrow down who are the patients that is of a higher risk and may need more help than the intervention. And overall, it will help in reducing the healthcare workload, and it will be on the productivity aspect itself. In terms of the so-called insights itself, last year we have a collaboration with the Changi Hospital on this a solution we call CAPE, which is based on the chest X-ray. We are trying to infer the patient, what is their pneumonia condition like. And same thing, this is to assist the radiologists among their a lot of work to pick up the insights about the patient itself, how the patient condition will look like from the chest X-ray. Today seems like they are going to have a very serious pneumonia case, or they are okay. That means they are okay with the normal clinical intervention that's going to apply for them. That will be the insights that will bring on to the patient, assisting the clinicians. Yeah.
Right. Fantastic. And I think now coming to this whole idea of building AI algorithms, it's difficult to do it without good data. And I think just now also, I think Leong mentioned this whole idea of digital noise as well. So there is so much data that's coming in, but how do you make sure that all of it is actually ready? And I'm going to come to Rob for this one. What are your thoughts? What are some steps that possibly could help?
Well, the one thing that is a recent buzz here in this country is you need a data strategy. You need to sit and think about this before you dive in and figure out what are you trying to accomplish. And then back to, as I said before, where is your data? Is your data clean? I think as Dr. Goh was saying, is your data able to be put through analytics, right? It's not as simple, just put it in there and it comes out and there's a light bulb that comes on and you have an answer. There's a lot of work that has to be done to get the data to where you can run analytics on it, and then you can look at the answer you got and to see if it's anywhere near what you're hoping, and then refine your analytics as you go. So I think the steps that are required really are this upfront thinking. We've named, there's a position now that didn't exist when I was a CIO called a chief data officer. It was actually part of my job. But now there is a person and a staff whose job it is to think this through about the applications that are producing the data, who's consuming it, what are the formats, what are the utilizations for one type of data, because it could span healthcare to personnel things. There's lots of places where there's overlap, and you have to decide how you want to handle it, because the consumers of the data are going to do what they need to do, and they are only looking for the producers to give it to them. So to me, this is really involving a fair amount of planning, which is hard because people like to dig in with the new technology and just start going. And in reality, it's sort of stop, settle down, implement. In healthcare, to watch 2 or 3 healthcare systems in this country interoperate, it depends on what application they're using. Are they using an application from Cerner? Are they using an application from Epic? What health insurance are you using? Because you really do want those to interact. But there's generally a lot of machinations that have to go on for those 2 systems to talk. I think Dr. Goh is agreeing with me, because so care is the thing that you're trying to render. You don't care where the data comes from. Back to what I was talking about before, you don't care. If you changed health plans, you now have data in 2 systems, and I'm one of those people. I probably have 2 or 3 systems. But now, when somebody wants to look at my record, they would have to look in 3 places as a minimum to go find everything about me, and then run that data through analytics and see if they could predict, that there's something else there. So it really does require an architecture, a data strategy to move forward.
Yeah, I hear you. I think what would you say to organizations then, or maybe agencies? Because I think at least right now it seems like everyone's fighting a crisis in the sense that, things need to go out fast, things need to be done really, really quickly. So what would you say to organizations who are trying to find that balance between, I need to have a plan moving forward and versus, I need to get this out the door for my citizens? What advice would you share on that?
I would say that fast is not necessarily good, right? Fast is fast. And so there just is a balance. And depending on the exact outcome you're trying to achieve, you'll understand whether you can go fast and be mostly right, or you can go slower and be, even more correct. Because the percentages, especially with COVID, the analytics that are going on with all the cases, children, the Delta variant, the Lambda variant, this must be analyzed very precisely, because you're going to now tell the public what's going on. And around the globe, people are expecting that their healthcare agencies are giving them facts, right? So they are balancing speed with precision. It just, you have to be mindful of both.
Yeah, absolutely. And now we've talked a bit about where we are right now, what we've managed to do with data and AI, what are some of the things that are already exciting us. But now let's maybe cast the lens a little bit into the future to look at what's possibly to come. So, Liew, I'm going to start with you. When you think about predictive AI, what are some areas that you think would be interesting to look into next?
Actually, I would say that predictive AI is a little bit quite mature as of now. So in terms of the next step of AI, I would think that there probably is two aspects. One, of course, is so-called physical AI. In the sense we're going to see more of this robotics AI itself. And that will really bring up the productivity that we seek AI can, or envision AI can do for us. The other part of physical AI will probably be the wearable AIs, where just now we talked a little bit more about digital phenotyping. So with all this wearable IoT AI, we can understand all these so-called the physical signal of the citizens better and the patient better itself. That's one aspect of it. And the other aspect of AI that I'm really looking forward to will be the merging of AI with software engineering. So there's some saying in the industry, if you have a problem statement and you put 5 data scientists in the room, after maybe half day, you will have 5 different data science or AI solutions about tackling the problem. If you put another 5 engineers, software engineers in the same room, then talk about the problem statement. After half day, you don't have a solution, but you will have a very good framework, standardization of how to do the things itself. So these two aspects of AI and software engineering need to merge together, because ultimately we want a good quality and consistent result, so that the AI can actually help in our life as well as in a different aspect of healthcare itself. That's my view on that. Yeah.
Fantastic. And Bruce, what about for NCSS? What are the next steps for data and AI?
Okay. So I like what Rob said. Something caught my attention. Really, it's you can go fast but less accurate, or you can go slow and be more accurate. That's probably a dilemma that we are facing right now. So when I mentioned about triaging and the risk assessment, right? Suffice to say, I mean, the accuracy now is probably not at the tolerable level, because imagine if it's 80% accurate, to most people, maybe 80% is quite high, but to others, that means 20% falls through the crack. And if we're dealing with crisis situations, right, that presents a very big problem. So I would love to know how we can go fast and still be accurate. Perhaps it's also a chicken egg thing, right? If more people adopt AI, there's more training data, and then AI becomes more accurate. But yeah, then who's going to start trying, and how we're going to get this done? So that's probably something I want to tap on Leong's brains, since he's expert here and he has done it for healthcare. I want to see how we can do it for the social service sector. So that's probably one thing that I would definitely love. Yeah.
Maybe I just add on a little bit. Yeah, as Bruce mentioned, actually for some use cases, it's actually very so-called bad, it will actually fall through the cracks itself. So for AIs, actually some of them can be configured itself. Either we have a so-called a good precision, or we have a good recall to change it itself. But there will be a lot of wider competition. Ultimately, we must do it start small scale fast, then scale big as well. So probably, as Bruce mentioned, we need a small test bed, and then subsequently need a more real-world validation to go about that.
Thanks, Anil.
Fantastic. And I think for now, I'm also going to turn to Rob. So from the different organizations that you've worked with, so I think all across governments from every part of the globe, what are some models or approaches that you've seen that you think there's something to be learned from, something to take away from?
I would say it's virtually unlimited. Each agency has its own mission. It could be healthcare, it could be commerce, could be taxation, law enforcement, whatever. But they can apply this intellect, right? This artificial intelligence, machine learning to almost any problem they want. And now we can connect just databases that were previously disparate, not connected. So now, back to the healthcare example, I can connect 1 million patients and analyze that data over maybe 20,000 patients, right? And so I see a richer set of data. I can draw conclusions with higher certainty, right? Data, the size of databases is no longer a problem. And 5 years ago, I think we would say, be careful, big data, we're just starting that journey. But I think there's just, whether you're in cybersecurity or you're doing quantum computing, you have an ability now to make use of data in rendering decisions, both, as Bruce was saying, quickly and with accuracy, but you have to get to that point. And I would say 80% is not a good number, right? For most things, but there's a certain number that you're within the tolerance range of what you're trying to get done. So to me, I also see AI as being something that will foster automation, right? So some of the mundane tasks that are being performed in any sector can now be done by machines. I mean, here we are seeing the age of machines, when I got into information technology at the turn of the century, this was the age of information, right? I think we're in the decade of data right now. I think we're at a place where we understand how to make use of data that we didn't understand a few years back. And so I see, like I said, virtually unlimited paths to success for government agencies to make the lives of their constituents better. They just need to sit down and do it.
Fantastic. I think that's definitely a hopeful message to be holding on to. And I think for looking at the next maybe 1 year ahead then. So I think over the past 1.5 years, we've seen a lot of change. Right now, government agencies are sitting at that spot where they're also thinking about, from where we are or where we've come, how do we move forward from here? So from that perspective, Han-Leong, what are some of your priorities for the next year? What is IHiS up to? What are some of the initiatives that you have lined up?
Actually, for that, of course, one of the things that we just now talk about is machine learning operation, focusing on the data itself. The other aspect probably is about technology related to unstructured data. So as more different data coming in, we also see that it's no longer the conventional database type of data that's coming in. It could be images, it could be free text, and a lot of so-called and information is so-called now being still encased in the free text itself. Like Bruce mentioned just now about sentiment analysis, that is one aspect of that. So unstructured data technology, there will be many, especially we can see that natural language processing is definitely one of the things that have been for many years. It evolved greatly with so-called deep learning as well. From the earlier days of just detecting certain keywords based on rule base, it moved on to detect relation as a small sentences, or even now widen to the paragraph itself. That will be the NLP. And also that with more and more data coming in, how can we connect them efficiently? How can we find meanings of them? What are the relation between the different data points itself? That will be things like graph technologies. So there are many of these unstructured data technologies about how do we treat data better, and also to mine their meaning of that. So that will be the two space that probably we will be looking at, or I will be looking at in the next years incoming.
Amazing, amazing. And for Bruce, what about for NCSS? What are some of the initiatives that you have lined up? Maybe within mental health, maybe outside of that?
Okay, maybe so just from the last 40 minutes or so, right? I'm quite assured by Rob and Han Leong that, technology for AI and for data is there. So I suppose one of the things I do want to work on is on the people part and to increase their data proficiency. I mean, I would love to have Han Leong, be part of the social service. He makes a lot of sense. He can help me make sense and storytell all the data, but I can't replicate him. And certainly I would, need much more many of him around. So I'm not sure how we can best do it, but that's certainly one area I want to build up. The other part really is in terms of processes. I shared earlier that we need to have the standards. I think healthcare is ahead of us. They have standards for the patient records and electronic health record system and all that. So that really facilitates data sharing and the 360 view and all the fusion and consolidation that Rob mentioned. We hope to get there one day. And those would be, aside from technology itself, those would be the other two areas that we want to work on.
Fantastic. And we are just heading into the final leg of our session for today. So maybe let's go for a quick fire round to share what are you hopeful or excited about. And Rob, if I could start with you.
I'm excited about some of the natural language processing that's going on. I mean, humans have been working for decades to figure out speech and actions of machines and or objects. And we're there. I mean, it's starting. I mean, we all see driverless cars. I actually don't think that one's that hard because we've been doing airplanes and boats and vehicles for many years. So they're more refined, obviously. But I like the fact that we're moving into a place where we can do language processing. So we're getting closer to how the human brain operates, right? And so I think that helps us understand the human brain even more, which then helps us with healthcare.
Absolutely. And speaking of healthcare, Han Leong, what are you hopeful or excited about?
In the longer term, I definitely want to see myself applying AI in genomics itself. That will be a space, I think, there will be even a lot more information because a very small, tiny genes itself actually pack a lot of information. And humanly, as a researcher, without AI or other tools itself, it will be very difficult or there will be great challenge to unpack all this information. And even natural language processing is one of the techniques that is having this possibility to help in genomics itself and sequencing. So that would be the thing that I will hope that I will be in the longer terms coming up. Yeah.
Fantastic. I think that's really exciting. For Bruce, what are you hopeful or excited about?
Okay, so I think Hannah mentioned about use cases now. That increasingly we're seeing the use of AI chatbots for mental health, like Mindline and all that. And I'm hopeful and that that becomes more commonplace. That increases the trust and comfort level that users have and clients have in interacting with such elements. And that builds up the accuracy as well. And then this becomes an iterative cycle that it becomes better and more accurate and faster in terms of deployment. So that's what I'm hopeful about.
Fantastic. Thank you so much. Thank you to all our panelists for sharing your insights with everyone today. And a huge thank you to our wonderful audience for tuning in. We've heard about the potential that data and AI can have in transforming public services and some of the steps that we can all take to serve our citizens better. We hope that you have learned something new and that you're excited about the new opportunities ahead. Coming up after lunch, we have a fireside chat discussing Asia as the next fintech hub. So please join Tan Bin Ru, who is the CEO of Southeast Asia at One Connect Financial Technology and co-chairwoman of Blockchain Association Singapore. She'll be speaking with Sherry Zhang, who is the editor of the Birthday Collective, and they'll be exploring the future of digital banking and digital economies. Thank you once again for joining us, and I'll see all of you soon. Until the next time, goodbye.